.3 Skies Metro FM. Welcome to the Est of Avocado, our show. It's me, your girl Vanessa Mdluli, and I'm gonna be your radio bae for the next 30 minutes. I hope Alaleli Namtla you're having a fabulous Friday. I know I am. And Namtlanje uhlelo we are gonna be talking about a very, very serious issue esluphayo. Not only singabantu abamnyama, but lasemakiweni as well. We are gonna be talking about the most savage silent killer, and that is a cancer. And as I always do, leyazi kahle mhlophe ngiyathanda ukuliphathela someone ozaba isethekeli sethu giving us more intel and more inside info on ama-topics esiwakhulumayo. Namhlanje ngiphathele ugqirha. We have Dr. Derek Matsika, and mana ngimeke let's introduce ke sithi fahla about himself, lapha sebenzela khona, and what he specializes in. Dr. Derek, welcome to the Skkrr Show.
Good evening, Miss Vie. Thank you for the lovely introduction. Sawubonani bakwamthwakazi. I'm Dr. Derek Matsika, based khonapha koBulawayo, and I'm currently practicing as a general practitioner, but nxa ngise UPH mainly ngiyabe department yesiza sithi surgery or eyenza ngeindaba zokuhlinza. So sizabe sisonke for the next 30 minutes, and sizabe siphendula imibuzo emayelana lomkhuhlane lo esithi ngesikhiwa yi-cancer or ngesintwini sithi imvukuzane. Thank you very much, Miss V.
Kubonga mina. So balaleli, if you have any questions elingabe lifuna ukuwabuza concerning cancer, we have a very good doctor ngapha. The number to send your messages is 0774 460 100. Or you can head on to the Skies Metro FM Facebook page. We're live. Gitilapa, it's light, camera, and action. And you can also write your comments there, and I'll be sure to read them. So, Dr. Derek, maybe what is cancer and what types of cancers are there?
In summary, when we talk about cancers, every part of the body has a specific function. The eyeball, the nose, the mouth, every cell particularly is specialized to perform a function on a day. But then when we talk about cancers, here we're talking about abnormal cells that have grown and sort of overtaken the normal function of that particular cell. And unfortunately, these particular types of cells tend to actually grow very fast. So let's assume it was a kidney, and you have these abnormal cells that are growing fast in the kidney, and they are taking over function of the kidney. Because they're abnormal, it will mean kidney alisasebenzi umsebenzi walo or keep it emzimbeni. And these new cells that are coming in, automatically it will mean the function ye kidney isanjani ayisekho. Now usually amabizo ama-cancer siwabiza depending where they are coming from, whether is it in the brain, is it in the heart, is it in the liver, is it in the skin. That's how we then name them, to say this is this type of cancer. And also depending on how fast it grows, or how aggressive the cancer is. That's how it helps our amabizo ankona ama-cancer.
Oh, wow, very interesting. And then in Zimbabwe, what are the most common cases? Like I know, like in Africa, I should say, like I think akhona diseases like angama serial killers, like TB or AIDS and everything. But cancer is a different ballgame. You know, with the AIDS, I feel like you can take amapilisi for it, and to see the 4 count or you can keep it under control and all of that. But with cancer, it's quite really different, isn't it?
Very true. With cancer, unfortunately, in our society, it's been, I think, one of the leading killers, particularly over the years. Yes, in the past, our biggest challenge was HIV. But I think with ARVs and with all the work that has been done, we have seen actually deaths from HIV itself going down, directly I mean from HIV. However, cancers have actually come up. Some of them are related to cancer, but what I'll do is I'll compare our statistics from other countries vis-a-vis in Zimbabwe. I think it's important so that at least we get an idea of China as a country, where are we? Usually when we Google on internet tends to give us the common things outside the country or what's there outside there in the world. but
Right.
it will, in few cases, zero in on what's happening actually around our societies or our communities. If we're to look in the world over, when you talk about the commonest cancers, you'll actually discover that among females, the most commonest is actually the breast cancer. And amongst the males, it's actually the prostate. That is world over. And you find females, the top three is breast, lung, and colon cancer. In males, it's prostate, lung, and colorectal cancer. But when we come to Zimbabwe, our community, there's a bit of a shift. Among women, actually, the commonest is cervical cancer. And most people might ask, Uguti, why is it cervical cancer more common, yet not the commonest world over? Unfortunately, for our community, and due to the fact that we've been ravaged so much by HIV, cervical cancer has become more associated with HIV, and that's why you'll find it's top up before breast cancer is still second in Zimbabwe, not first, but cervical cancer being the number one cancer that's affecting our community. In
And
males,
mhm.
yes.
No, you can continue. Sorry.
Now, and then in males, it still remains as prostate cancer. But
Mhm.
yes, our environment to affect how which cancers become commonest and not. And as I told you, amongst blacks actually, smoking is less. You'll find you rarely get as much smoking in our communities because our communities tend to shun that. But while if you go to Europe, I'm sure in your case
Yeah.
you
Oh, I'm a chain smoker
everywhere you
ngayenziwa
go,
this side.
somebody's got a cigarette in their mouth. Soon after every meal, vele dessert ligwayo esemlonyeni umuntu sebhema seyehlisa ukudla nge-cigarette one or
Yes.
two. So those things also affect what is common and what's not common.
What's not common? I see. Oh, and then I would also like to make the disclaimer very loud and clear. Uguti, asitsho ukuthi just because with cervical cancer you have AIDS or something. He just said there is a correlation, right?
That
So
way,
ayikhona phela selihamba licabanga ukuthi just because ule cancer sele AIDS. That's not the case. Uphonga nje ukuthi kungani kulobudlelwane phakathi kwakho. And so to Derek, like we hear a lot ukuthi stage 1, stage 2, stage 3, stage 4. What are these stages? And maybe ungasichasisela better like.
yes. Ama-stages, we use them as doctors so that nxa sixoxa njengoba sixoxa khathesi so when I tell you ukuthi umuntu le-stage 1, stage 2 kumbe i-stage yes 4, what we're just trying to do is a way of communicating between ourselves and also trying to categorize ukuthi umuntu ngendlela esikhangele ngayo ukuphila kwakhe ukuthi into leyi, is it a big thing or is it a small thing?
Is it a small
So
thing?
usually stage 1 ngeyokuqala sithi imvukuzane le or the cancer is still at its early stages. Stage 4, most cases we go up to stage 4, but of course some classifications might have stage 5. But iba istage yokugcina lapho esithi khona imvukuzane leyi isinkulu kumbe sispreadile kumbe sa-affect umzimba wonke. Ideally nxa izinto zivuma and yonke into i-right, we always prefer to catch it while it's still stage 1. Stage 1, in that case, what we're just simply saying is this thing is still very small. The
Can be
effect or the
controlled.
impact of this thing can be either controlled and in some cases actually cured, where somebody becomes disease-free from the cancer.
From the cancer.
Unfortunately, in our community, that's always difficult to find. Because stage 1, eqinisweni umuntu kezwa like literally nothing. You're just your normal self. You don't have no pain, you have no discomfort. Life is normal. But our wish was to find most diseases at stage 1, but majority are curable at stage 1. Unfortunately, stage 4, that's where the problems come in. And that is when we tend to find most of our people besiza khona. Uyabe sesizwa ubuhlungu, uyabe sekulesilonda esingapholiyo, uyabe sele discomfort emzimbeni. And usually when we say stage 4, we're saying this disease has now gone beyond our control. In most cases, we're now doing a palliative care. We're just assisting you so that you're not uncomfortable. But chances are we cannot reverse the damage that has occurred.
Wow. Ish. It really is savage. Esther Piri says, "Hi, Doc. We love this. Thank you, Esther, for tuning in."
Thank you very much, Esther.
so, uh, so are there any foods that people can avoid or eat to prevent a cancer or to like eliminate the chances of them getting cancer? What would you advise njengodokodela?
Now, usually, I think the beauty about life always starts from basics. And if you go to when people were being taught in the primary schools, everybody used to talk about a healthy diet or a balanced diet. And those basics are always important. Unfortunately, with life stresses and people trying to be all flamboyant and enjoying, especially with Friday song also and so many things. But those basics we can never run away from. And you will always find ukudla, especially fruits. Fruits are always rich in vitamins and I would also minerals. Those things are important in boosting our immune system. Believe me, the body always has its own ways of fighting anything. Umzimba uyazama yonke indlela yokulwa. And it's always important ukuthi nxa sisidla lapha siwuncedise umzimba wethu so that our bodies are strong. So always high fiber diet, food that's unrefined, or onyawuthi, amabele, umgayiwa, food that are fruits which are rich in vitamins or vitamin C or vitamin D. All those things are important in arming the body ukuthi nxa kungaba lento ekhona encane la umzimba ukwanisa ukulwisa. Believe me, the body always makes an effort before it succumbs ukuthi la ukwanisa ukulwisa. So those things are important. Yes, we might love our meat, but unfortunately most of our meat is processed. Those things that are used to preserve our meat actually make us very prone to ama-cancers, amathumbu, ama-cancers esisu, ama-cancers esophagus. That's why we're finding that in our communities, those things are actually becoming more now than ukudala. Ngendlela esidla ngayo yezinto esizithanda ukuzinatha particularly nxa kungama-weekend kanje.
Yo. Yeah, ne? So balaleli lizizwele, try avoid inyama and stick to izinto zethu ezesintwini lezi ezazidliwa ngabokhokho bethu. It could save our lives. And the other thing, do topic ointments njengabo cream, the bleachy skin lawa or the sun exposure to some chemicals, do they have the ability to contribute to the cause of the cancer?
Yeah, that's a very another important topic. Ngiyakwazi ukuthi ubuhle buqakathekile kumuntu wonke ongumama. But sometimes black is also beautiful. And kuqakathekile ukuthi sizwisise ukuthi why thina skin sethu sile advantage enkulu ngokuba le melanin. Now, there's a reason why God put us on this continent, despite all the sun rays that we face every day. And amakhiwe ngabuye ezohlala eZimbabwe zamza within 2 days, sengitshile, sengifuna sunscreen to protect my skin. Yet umuntu omnyama, our ancestors never complained about sunburn. And I mean, up to now, most of us never put any sunscreen. So
Never.
our skin actually protects us. Ukuthi khona nxa sitshiswa lilanga lapha, iyakwanisa ukusiprotect ukuthi singaafectwa ngama-UV light. Yet that's why you find the skin cancers are actually more common among the whites compared to the yes, blacks do get skin cancers, but they're more common among the Caucasian or the white or so-called whites. Then kule group yabantu abangabamnyama kodwa abangala melanin, especially group yabantu abe-albinism. You find they also suffer from a lot of cancers because their skin lacks that melanin to protect them against an UV light. So it is important to appreciate it. Also, skin lighteners, you're actually taking away that protection and you're exposing yourself to that intense UV light, which, as I said initially, will make you susceptible to imvukuzane skin. So yes, they do affect because they are already taking away the protective effect of your natural skin, which is beautiful, by the way. So I hope I'll encourage more women to avoid those skin lighteners.
There are a lot of men who also
unfortunately,
bleach.
yes, we've seen especially our folks, some of our folks, they seem to be taking up in also in some of these things.
So, moving along, esintwini siyake sizwe kuthiwa unazibanibani umbusazibanibani bamfaka imvukuzane. Is it literally possible ukuthi black magic yenze cancer or like abantu lihaba nje? What's your take? I know it's not maybe related to medicine or anything, but
I'm not. I know some isintwini we can't separate people from their beliefs, and our beliefs naturally will tell us ukuthi khona, everything has a cause. And our beliefs always have this thing ukuthi umuntu engagula kule reason why umuntu egulile. And that reason we always seek to find, whether we find it spiritually or through other spirit mediums. But medically, most cancers have a cause which is medical, and we've tried to explain that as much as possible. But thina nxa sithi umuntu ulemvukuzane sabe sitsho ukuthi, I know sometimes isintwini asingeke sakhuluma wonke amabala akhona esikhiweni, but sabe sikhuluma ngawo ama-cancer le kade ngiwatsho. Thina ku-science sithi hayi akulanto ezinjalo, but yes, I respect people's beliefs and people of understanding of life.
Yeah. Well, I know abantu, we are always too quick to say siyaloya. Sometimes it's not about lawyer. It's just something abnormal like inside of umzimba because of food and other factors as well. And then we recently lost one of our most talented comedians, Clive Chikubu. He succumbed to lymphoma. Could you maybe give us a little bit of info on lymphoma? What is it, and iyenzani kahle kahle emzimbeni?
All right. Into eqakathekileyo, sometimes we try to take a step back to explain it. Kule system emzimbeni njengokuhamba kwegazi sibiza sithi lymphatic system. I-system leyi ithwala amafutha njalo futhi ithwala futhi lala siwabiza sithi ngesikhiwa ngama-white blood cells kumbe amasotsha omzimba. Now, unfortunately, this system also can be tempered due to many other things, whether it's infections like viral infections or other infections. So what then happens is, because i-system le ithwala amasotsha omzimba or ithwala amafutha, amasotsha omzimba sometimes agcine multiply. It's natural ukuthi ngagula mina amasotsha omzimba azamultiply elwisa ukugula lokha. Kodwa ukungezelela kwabo kungayehluleka ukucontrola, multiply too fast. Kuyadisturb i-circulation lokuhamba kwezinto emzimbeni. This is where kuvela khona la ama-cancer kuthiwa ngama-cancer egazi kumbe ama-cancer lymphatic system. Now, uhlupho olukhona ngama-cancer lawo esikhathini eziningi, remember i-system le ngithi ihamba umzimba wonke, so they are very difficult to control. And ngibona omunye umbuzo lapho umbuzwa ngomunye umlaleli uthi khona, is it possible ukuthi drain ama-lymph lawo ukuthi prevent i-lymphoma cancer le? Unfortunately, you can't drain the lymphatic system. Ngoba kunjengokuthi drain igazi lakho lonke usalungala gazi. That's impossible. So that's where the challenge is. And most of them tend to unfortunately be related with umuntu owagula mbijana okwaba lo mkhuhlane utrigger ukuthi into lezi zimultiply. But zithi ezimultiplier zehle kunjani ukustop multiplication. Now, not cancer le, in most cases tend to be sensitive to treatment esithi chemotherapy. But i-challenge enkulu ebantwini is accessing the treatment. Yes, we don't manufacture these things elizweni lethu. Into esizithenga from outside the country. That means esifuze sithola amadola. So I told you, umuntu angathola lele cancer leyi every month ebisevuze budget 2,000 US just to uthola imithi nale ethiwa chemotherapy.
2,000.
How many of us, including doctors, have 2,000 to spend every month for the next 6 months or 3 months just to uthola umuthi nalo ukuthi uphile, or we control or we stop the disease there? So it's very difficult. It's one of those difficult cancers that tend to be a challenge for us. Yes, improvements in science is working on trying to find ways to control it, but lapho othola khona imithi, in most cases uthola umuntu aqasa umuthi kodwa ehle ukuqeda ikhosi ngoba imali yabisinjani
Yeah.
So that's the biggest challenge we have.
That's the biggest challenge. Well, ngapha Austria, they actually have a very an admirable actually medical system, like a social system abalayo when it comes to treatment of izinto. In Austria, if usebenza lapha, you've worked, you've paid tax, even ungasasebenzi, you get access to free healthcare. Like if you're unemployed, you register yourself ukuthi you're unemployed, and then ungabatholakala uthole cancer, you don't even pay a single dime. So these are always the things, as always, I like to compare okwenzakala Austria okwenzakala ekhaya. And I'm always like, oh man, ekhaya we can do so much better, you know? So it's such a shame ukuthi kithi, cancer is literally a death sentence because of failure to have izinto zangikhona and the working medical system and medical aids that can really help abantu. And I always find that so tragic. So Precious Ndebele says, yo iqiniso ukuthi treatment isuka idule cancer. Yeah, that's true. Isuka idule. So, doctor, I've just found out I've got cancer. Saying in zilabo biopsy land. What's the next step? What happens after that?
In a normal health system, we always say, ideally, everyone should have what's called a family doctor. A family doctor umuntu wakuqala oqalisa ukukhoma laye omjayileyo okwazi ukuthi nxa ule flu nxa utshaya likhanda nxa uvuka ungathabanga nguye udokotela wakho oqala ngaye. And usually that system is important to maintain because kule sithi yi-referral system. I know these days wonke umuntu engagulelwa mbijana uthi mina sihle ngifuna ukuyabona uSejoni ngoba sekwagugula mbijana. But the challenge that happens is you then sometimes end up in the wrong department at the wrong time. So usually we say every muntu ogulayo qala ngo-family doctor wakho. Now, depending ukuthi cancer mhlobo bani, you will be then referred to the appropriate doctor ozakuncedisa, and also depending on stage. Amanye ama-cancer ngamathumbu kuyafuze ubone odokotela abadila ngamathumbu. Amanye ama-cancer ngo-stage 1, o-stage 1 bahle njengoba ngitshilo ukuthi stage 1 esikhathini eziningi unjani iyalapheka. Siyahamba udokotela ifike equma kwinto owesiwa kwinto lokhu ufike wasokunjani sokuphelile. Amanye ngo-stage 4 akusaqumeki bayakurefera kulabo kuthiwa ngu-oncologist. Emazweni amahle njengabo-Australia lapho khona uzathola ukuthi even u-oncologist wangikhona kakuphonga kuthiwa ngu-oncologist. Yabo lo oncologist othiwa ngowekhanda, kulo oncologist wamakhala, kulo oncologist womlomo, kulo oncologist wethumbu. So you will find ukuthi you are then referred to the appropriate muntu ozabe akwazi ukuthi hayi nxa yi-cancer yemakhala mina umuntu lo ngizabe ngimlapha amakhala kuphela ezebe ngcono. So usually I always tell people to qala ngodokotela wakho wokuqala so that bezwisise ukuthi le bathole i-cancer iku-stage bani njalo futhi ama-options e-treatment yiwaphi ahambelana lemvukuzane le. So into eqakatheke kakhulu.
Into eqakathekile. Okay, Tabile Ndlovu says, well done, Miss Vie. This is a good topic. Siyafunda. I'm happy you guys liyafunda. That's the aim. Ukuthi sifundisane and sibe ilizwe elithuthukayo lathi sifunda from other people who have more knowledge than we do. So, fine. Cancer, you can do radiotherapy, chemotherapy, but as in everything else, ulama side effects. What are the side effects for doing these treatments? I'm sure like ukubuya le sikhwama sakho kodwa like okufanele usigaxe. What is it?
Very true. Unfortunately, entweni yonke esithine esiyenzayo njengabodokotela siyabe sizama ukunceda. But ekuncedeni yebo kulalokho esithi ngama-side effects or sometimes kuthiwa ngama-complications. Now kuqakathekile ukuthi abalali bebekwazi ukulapha kwezinto kuyachiyana. Kule surgery, kule radiotherapy, kule chemotherapy. Surgery sikhuma ngendaba zoku-operate. Usually nxa ungama-cancer lana asakuma-stages angconywana njengabo-stage 1, stage 2. Usually uzathola abantu abaningi bajala uku-operate kuhle kuphele ehle bekwazi hayi akusela mvukuzane. O-stage 3 labo-stage 4 esikhathini eziningi yibo abantu esijala ukuthi no asidingeni ezinye indlela zokuthi i-cancer leyi noma ingasapheli kodwa asizameni ukuthi ingasakhuli or ingasa-affect umuntu ngendlela engasazwa buhlungu or isilonda lesi singabi lokhu esibhibhiza. Yikho lapho kubuya khona kuthiwa yi-radiotherapy le-chemotherapy. Lakho kunjalo kulama-complication nawo ngoba unfortunately ngesintu nxa sikhuma nge-radiotherapy sesikhuma khona indaba kuthiwa yikutshisa. Though technical aso ukutshisa ukuthi nje sabe sisebenzisa lokho okunjengama-x-ray ukuthi singakufocus endaweni eyi-1 kuyabulala ama-cells anengasakhuli. Chemotherapy sabe sikuphi umuthi. Na umuthi lo into abantu afuze benanzelele ukuthi umuthi lo anti uzama ukubulala into zonke ezinjani eziphangisa ukukhula emzimbeni. But umzimba wethu wonke ulenyama ezikhulayo. And sometimes umuthi lo iyakwazi ukwehluleka ukuthi ubekwazi le yi-cancer lo ayiso cancer. So yikho lapho vela khona ama-side effects angikhona. That's why uthola abantu abaningi abakuchemo inwele eziphangisa ukukhula ziyanjani ziyakhithika. Igazi elifuze lalo libe liningi ligcina lililutshwana ngoba alitshanga imvukuzane kuphela but litshaye futhi ne-bone marrow and bagcina bekuba lama-infection lama-problem. So that's why uthola ukuthi singakawuqalisi sithi qala uyebona ingcitshi eyani eye-cancer kuthiwa ngama-oncology. Lami njengudokotela lami ngiyakhe ukuthi hayi hambe ebona ingcitshi yama-chemotherapy kuthiwa yi-oncologist ozaba kwasi nxa ekupha umuthi ihlale laye kwazi imithi leyi ngaba le problem ngiyayipreventa kanje lokuthi umuntu wami ephole kuhle ngalasini. So yes, it's toxic medication but iqakathekile ukuthi umuntu impilo yakhe ibe lokhu isiya phambili.
Wow. And then ukugugula abazali Mahlangu, thank you so much. Siyabonga dokotela, we are really learning a lot. So I wanted to find out, is cancer genetic? Because let's say for those abele breast cancer, velo on the issue of your breast cancers, let me do it real fast because it's still 5 minutes only.
Yes.
Would you advise laba sebeke I think what mammogram, I don't know, maybe not name it.
Now,
What's it called?
Okay, mammogram. Now,
yeah, mammogram, I was right.
Yes. Now we talk about screening. Screening comes in different forms depending on the type of cancer. Nxa amadoda kukhona uhambe ubona udokotela lama-blood tests ayenzayo. Nxa ungumama kulalaba sithi ngama-VIAC, ama-pap smear, o-mammogram. I-VIAC labo-pap smear indaba zemvukuzane zomlomo wesibeletho, i-mammogram ngamabele. Now kuqakathekile ukuthi wonke umuntu ebekwazi ukuthi nxa eke waba lomuntu wangikhaya okwagula imvukuzane, i-chance ukuthi nxa wangikhaya eke waba le-cancer lawe ule-chance more than 50% ukuthi ungaba layo. So it's true, some cancers actually run in the family. Not all of them, but some. That's why uthola amakhiwa ahambe yenza kuthiwa yi-genetic mapping. Behambe becheck ukuthi ngivele ndilayo yini i-gene ye-cancer. Ukhona omunye asoyimqambe ngebizo but umuntu azala esile emhlabeni wahamba wakhangela watholakala ukuthi hayi emulini yabo kulomuntu okwaba le-breast cancer and layo i-gene ye-breast cancer layo. Wathi wahlakanipha wakhipha wafaka ama-plastic. So yena sekwazi ukuthi nxa umkhangele ungani unormal kodwa yena wakhiphani wakhipha konke lokhu. Yes. So
sometimes it's worth
possible
it.
to do. And yes, genetically we do get those cancers.
Talent mpofu uyabonga njalo, and then ulungelo uyabuza ukuthi do steroids help to slow down cancer?
Now steroids, please note that steroids, remember steroids don't necessarily slow down the cancer, but we use steroids in treating people with cancer. Why? Most steroids ngakhangela are purely chemo. Remember, and take chemo is umuthi or toxic, meaning it will trigger certain reactions in your body. So those reactions have to be controlled by steroids. But you need steroid you can't give it in a cancer because this steroid will reduce your immune system, meaning imvukuzane will quickly actually will actually cause more problems in your body than you have wanted. So this steroid yona ngokwayo but sisibulendlela esisebenza ngayo.
Okay, then what's your advice for laba who are living with cancer? I mean, I have a malume who has what's it called? Now he's prostate cancer. You know, he's living with it. I'm sure he's also listening and would like to know. 2 minutes is it? How do people with
my best advice to anyone, a positive mind. A positive mind is always the most important thing. Believe me, most people, they're not defeated by the disease, but they're defeated by the mind.
By the mindset.
The moment you give up as an individual, life will also give up on you. So no matter, yes, sikhuluma ngamithi yonke le yonke esikhuluma ngayo, but i-positivity yengqondo iqakathekile ngoba noma ule cancer njani, most cancers are actually slow growing. So most people actually who die are people who give up on themselves. Kuthiwa ndemvukuzane uzibani yamthatha. So it means I'm sensitive, I'm giving up on myself. So first thing first, yes, we might not be perfect to have everything, but the mindset is the most critical thing. They should always be positive no matter what.
They should always be positive. The battle is won in the mind, maqala, than on the battlefield. Marvela Suti, it's very educative and you'd love to have such topics every week. Well, azukiti ulomhao. Unfortunately, usesidlele isikhathi sethu and we just have to go. But Valeria, I thank you so much for tuning in. Thank you so much. Go over to his Skkrr page, like us, follow us, and tell us some topics elifuna sikhulume ngawo. That's the only way I can know ukuthi lifuna ukuzwa ngani. And for lina basekhaya, lifisela lonke a beautiful weekend. Siyabonga njalo Dr. Derek for insight yakho and your knowledge and for sharing everything with us.
Thank you, Mtwagazi, and thank you for all the listeners. Have a lovely evening.
Have a lovely evening. Sizobonana futhi next week, same time, same place on the SWKRR show. From me, Miss Vie, ngithi sale kahle.